What's up, ladies and gentlemen? Welcome back to NeuroSketch. Dr. Ken. Welcome to quick recap on extraocular muscles. So we have 7 extraocular muscles. The first one is called the levator palpebral superioris, and then we have 4 recti muscles, 4 straight muscles. These are superior rectus, inferior rectus. We have the medial rectus and the lateral rectus, and then we have 2 oblique muscles. These are superior oblique and the inferior oblique. What is the nerve supply to this muscle? This is easy because all these muscles are being supplied by the oculomotor nerve, which is cranial number 3, with the exception of superior oblique muscle, which is supplied by cranial number 4, which is a trochlear nerve, and then the lateral rectus is also being supplied by abducens nerve, which is cranial nerve number 6. So these are the nerve supplied to all these muscles. These are the muscles in different pictures, and these are the nerves that are supplying these muscles. They might be looking scary, but no, don't worry about them. And then, so what happens if someone has got injury to the oculomotor nerve? This is a classic presentation of oculomotor palsy, whereby the eye is down and outward deviated. So we have down and out deviation of the eye. We have falling of the superior levator palpebral superioris, and then we also have pupillary dilatation. So down and out, dropping of the upper lid, which is called the ptosis, and also pupillary dilatation. Pupillary dilatation that defines the oculomotor nerve pulse. Next, we have the trochlear nerve palsy, and in trochlear nerve palsy, remember, the trochlear nerve is supplying the superior oblique muscle. So if you have injury to the trochlear nerve, you are denervating the superior oblique muscle. What happens? You have a little bit of upward deviation of the eye, and so your client will complain of failing to walking downstairs. So the patient is failing to walk downstairs. Why? Because the eye is a little bit deviating upward, and that's gonna be due to superior oblique muscle, which is nervated by trochlear nerve. Next, you have your abducens nerve, and the abducens nerve palsy resulted to paralysis of the lateral rectus muscle, because the lateral rectus muscle is supplied by abducens nerve. So what happens if someone has got abducens nerve palsy? The abducens nerve, the lateral rectus was there to abduct the eye. So if you have damage to the nerve or this muscle, meaning this eye will be turning inward, so you have medial squint, you have medial deviation of the eye, which is called the medial squint. And so if you have a medial squint, means you have injury to the abducens nerve or the lateral rectus muscle, and this is going to be unilateral, the same side of the lesion. If the right abducens nerve, you have medial squint of the right eye, and if the left one happens the same. So your client will complain on all these conditions. Your client will complain of double vision, seeing 2 images. Why? Because the eyes are lining in different directions, and they're going to have different point of focus. And this is a little bit on the extraocular muscles.